Hello. So today let's talk about the link between back pain and inflammation. So back pain is commonly encountered by busy mums, and it is something that may be going on in the background, or it may be something that is stopping you from doing your everyday work as a mum or as a professional at work. And it is not very uncommon to have back pain. But how is back pain related to inflammation, and really, why does it matter to you? So, in today's video, let's understand the link between back pain and inflammation, and why does it really matter to you. So, before we get into the topic for today, for those of you who don't know me, my name is Swati. I'm an executive mom power coach, and I help moms of younger kids who work in high stress executive jobs to manage their spinal, that is back and neck, and nerve pain, despite brain fog and forgetfulness and low energy levels, something that mums come across in usually in the earlier mommy days, or even when your kids are a little grown up. So I do all of this by giving you simple exercises, easy lifestyle changes, some modifications in your lifestyle, and some hacks, tips, and tricks that have helped me in my own pain and adrenal fatigue journey. By adrenal fatigue, I mean lower energy levels and brain fog. Now, I do all of this without taking away a big chunk of your time because, hey, we're moms, we're busy people, right? So let's get into the topic for today, which is understanding back pain and inflammation, and what is the link between these two. Now, what is the role of inflammation in back pain? Actually, let's go back a little bit. What exactly is inflammation? So, there is a natural immune response in our body whenever we have an injury or an infection, and it is designed to protect our body. It is designed to promote healing in the body. Now, whenever tissues are damaged, suppose you fall down, you scrape your knee, right? So, there's a damage to the tissue. Now, the body releases some chemicals that causes the blood vessels to leak the fluid into the tissue. It can lead to swelling. Of course, this response, while it is protective, can also cause pain and stiffness. Now, imagine this happening in your back. So, I'm not saying you fall down and hurt your back, but whatever the reason for your back pain, see, if you have disc problems, you have spinal stenosis, degeneration, whatever is happening in your back, or arthritis for that matter, whenever there's inflammation in your back, maybe the body's trying to protect you with all the responses towards that problem in the back. However, there's inflammation that's created, which is protective, but it can cause pain and stiffness and other issues in the back in the long run. So, let's look at it more in the context of back pain. Inflammation often arises from these conditions that I just mentioned. When the spine and the surrounding muscles are injured or inflamed, this response can lead to persistent pain and discomfort. Now, if you are a mom who's working in a high stress executive job, you spend many hours sitting or traveling or in stressful environment. Of course, then when you're stressed, you tend to hold your back a little more stiff. You hold your spine in a more stiff manner, and that can obviously aggravate your back pain. Anyway, let's go back to how what's happening at the level of your spine. Now, your spine is a very complex structure. It's got the muscles, ligaments, discs, etc. The inflammatory process that's happening in the spine can affect any of these components, and it can, for example, in case of arthritis, the inflammation can cause a breakdown of the cartilage in the spine, reducing your mobility and increasing your pain. So, those with arthritis will always complain of that stiffness and that back pain, right? So, this is what is happening. Now, another example would be herniated discs or slip disc or ruptured disc. Now, in that case, what happens is when the disc is okay, when the disc is bulging, I'm not going to go into details. If you want the details, I've done a couple of videos on, you can check them on my YouTube channel. And that has the details of what exactly happens when you have a disc bulge, from the stage that is the very first stage where you have a little bit of a bulge to when the disc is completely out of its place. That, of course, needs more surgical management. But I talk about it in my YouTube videos. If you can't find them, just go to YouTube, type my name, Swati Prakash, disc or herniated disc, and those videos will come up. All right, going back. So, when you have a disc bulge, what happens is when the disc is bulging out of its place, it can cause a lot of stress or pressure on the surrounding nerves or the air or whatever the structures are in the spine. that itself can lead to a lot of pain and inflammation. Now, if this disc bulge is in your lower back, that is your lumbar spine, especially the lower part of your lumbar spine, it can lead to irritation of the nerve that exits the spine in that area, which is known as a sciatic nerve. And you might have heard of this condition called sciatica. So it can lead to sciatica, which basically is a pain that radiates down because of the irritation of that nerve. It radiates down into the bottom back of the thigh, back of the calf, and into the foot. So this is a brief overview of what happens at the level of your spine when you have inflammation. Now, how do you know if you have inflammation? And if you have inflammation that is causing back pain, or if your back pain is actually related to inflammation in your back, because there is another type of back pain which is known as sorry, not inflammatory, mechanical back pain. So there is two kinds of back pain. One is inflammatory and one is mechanical. So if it is, how do you know if your pain is inflammatory or mechanical? So some of the very common symptoms of inflammatory back pain are morning stiffness, like we were just described in the case of arthritis. So you have morning stiffness where you have pain and stiffness when you wake up, and it slowly improves as you move about, and especially after a few minutes of movement or a hot shower or a hot pack, you feel a little better, and that stiffness tends to decrease as you go about your activities. Now, it can also manifest as persistent pain, which is pain that lasts for more than 3 months or doesn't improve with rest. Now, this is very subjective. It really depends on what exactly is happening in your back, because there's like a n number of conditions, there are numerous conditions that can lead to inflammatory back pain. So it's not necessary that you have to have all these symptoms, but if you have one or more of these symptoms, you might think, okay, I might have, excuse me, inflammatory back pain. And then you can go to your doctor or your physical therapist or whoever's your healthcare professional, and then discuss it with them. So that's the point of these videos, so that you can actually discuss it out, and you can with your doctor, and you can have an idea of what's going on in your back, right? So another thing is night pain. Now, it's the pain that disrupts your sleep and doesn't ease with changing your position. Suppose you are in a supine position, so basically you are sleeping on your back, and you have this back pain, and you turn around to say one side or the other side, or you turn around, sleep on your tummy. Well, that's not something I recommend, but if you turn around and change positions, the pain just doesn't go away. So it could possibly be an inflammatory back pain. Now, understanding these symptoms will also help you to recognize that inflammation is contributing to your back pain. And of course, then you can go for appropriate medical interventions, or medications, etc., which of course your doctor can advise you about. All right, so that's all I wanted to address in this video for today. Now, if you have inflammation and you're looking for an easy, I wouldn't say easy, but you're looking for ways to decrease your inflammation, I have done a video on this. And what I'll do is, I have written a blog on this topic about the connection between, or the link between, your back pain and inflammation. And in that blog, I will insert that, or put in that video that talks about how to reduce inflammation naturally in your body. And I will also leave the link to a 11 days free program that I have done that has helped me reduce my back pain down to absolute zero. Yes, so I had back pain, especially after my two pregnancies, and you know how it works with moms. You are fine, and then you put on a little bit of weight, then you have this pregnancy weight, and then with the kids and everything, it's difficult to shed that weight. You tend to get back pain, etc., etc. So I was the same as probably all the moms who are listening to this video. And as a professional who knows how to work with back pain, I could never get that back pain down to a zero. But I managed to do it the moment I addressed the inflammation in my back. So the free program that I did was just 11 days, but hey, 11 days is nothing, right? If it gives you that result, that freedom from the back pain, I think it's worth it. So anyway, have a look at that 11-day program. There is a link in that blog, and you can have a quick look and see if it's something that might work for you. All right.